Pinsky, host of Ask Dr. Drew and Chief Patient Officer at the Wellness Company. Dr. Drew, it's wonderful to see you. Now, listening to that interview is very painful. I want to first talk about the schizophrenia that we've learned about, because you've talked about this before, that marijuana use at a young age can also trigger schizophrenia if used early and often, and sometimes later in life. Thoughts here tonight?
And so can hallucinogens, and he was well known to have been doing all of that at one time. It really may not technically even be schizophrenia. It may be just some sort of chronic illness, psychotic illness from all the brain injury of the drug. So to call it schizophrenia, to suddenly arrive at that diagnosis later, it's suspect. That usually comes on age 18 to 22. But it does bring up the issue of co-occurring disorders and addiction. It just makes things that much more difficult. And psychotic illness these days is routine, both from the cannabis and from the methamphetamine.
Violent psychosis, schizophrenic disorder, bipolar disorder. I mean, that Harvard study on all of that, just, devastating stuff. What do parents do in those situations? We saw that A&E clip in that intervention show. Is again, devastating stuff. But what do they do? Because Rob Reiner was blaming himself, which is also heartbreaking to watch.
That's right. That's right. Look, there are untreatable situations, let's be fair, but there are also things you can do. I want everyone to think about the disease of addiction. A perfect model for it is the plant in the Little Shop of Horrors. Do you remember that, the Audrey tube? If you go near the plant, it eats you. It brings you in. It makes you part of the plant. And that is the nature of addiction. You cannot do it alone. You, as a loved one, must have ideally an Al-Anon group, a sponsor in Al-Anon, and a therapist whom you speak to before and after essentially every interaction with the addict. Because every instinct you have, every wonderful instinct you have, will be used by the disease to maintain the using. So we have to be super aware of that. The other thing I want people to be aware of is, Nick got going in his teens. If you find paraphernalia or substances on a child, in their room, in their backpack, during adolescence, you have a major problem on your hands. If they've gotten so sloppy that you, the parent, are actually finding this stuff, that is not a parenting problem. That is a mental health crisis, and it needs a referral.
And Dr. Drew, my father was an alcoholic, and until he decided he wanted to be, treated, then it's a disaster. They have to decide they want to get there. I know your daughter is a recovering cannabis addict as well. You've dealt with this. I've dealt with this in a different way. Your words to parents across this country tonight, many of them, feel like they don't know which way to turn.
But I want you to think about it this way. Here I am, an expert in addiction. I have not just my daughter, I have several family members with addiction around me. And I thought I knew how to handle things, even as these things emerged, and I was becoming aware that there was something going on. But the reality is, I had to go to Al-Anon. I had to get a sponsor. I have to be a human, a parent with somebody in my life, someone I love, with this thing. And there are programs and support groups and ways that this gets managed that even with infinite fund of knowledge about the disease itself, you have to do these practices in order to not be a part of the problem.
And not to be not part of the problem yourself, and just continue to, I mean, the word enable is, it's overused maybe, but we can all fall into that trap. Dr. Drew, so powerful tonight.
Immediately.
And we hope someone can be helped by watching this segment, or many people. Dr. Drew, thank you.
Appreciate it.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.